This morning, Bettina Mirimu, a resident of Lugala in Kampala's Rubaga division, had a hard time walking to the clinic in her neighborhood. Using a crutch, she hobbled slowly down the hill. Namirimu is a sickler.
Teri wa boda asobola kutwala kuba ate era bajiba bajja kuba nze kati sikira okukuba etuyisizza bubi kubanga okugamba ng'oli mu pain bakutwala omala okulaba RDC nsuubira sickler.
For a sickler, nighttime comes with a lot of apprehension and pain because that is the time when many of them, such as Bettina Mirimu, get attacks. And every time the attack strikes, she needs a shot of diclofenac. But then again, nighttime is curfew time. With the restrictions on the movement of cars and border borders, accessing health care has now become a challenge.
Nasuze bubi. Sobola genda kiro toyina wojja kuyita. Abasajja baba kuuma buli wa musaawe mbabadde bamaze okuyita muno omwafu. Kati ankubye bukubi kayiso n'akugamba gumu kitundu. Ate bw'ogenda mu malwaliro nga amalala ge tubadde tugendamu kuba waliwo eddwaliro awo Emmengo lye ŋŋendamu ssente zisingawo.
I don't see families moving at 3 in the morning to the RDC's office to seek this permission so that they can take this patient to the nearest point of care. And normally they break down, they could be breaking down probably because they are anemic, they need a transfusion right away. They might be breaking down because they are stressed if they are adults. One of the causes of death in sickle cell disease is actually stress in the adults.
Today, the Minister of Health said that Kampala Capital City Authority and the different district health officers will soon avail buses and cars to transport those with medical emergencies to hospitals.
All other services will continue as usual. Patients are free to access medical services during this time by boarding the available vehicles pre-positioned by the districts or KCCA.
However, people who get desperately sick at night are still out in the cold because they still need to get permission from the resident district commissioners to be transported to hospital.
Kubanze wema mbalaba ku TV mbadde mbalaba nga bali kumukumu baze kusaba buyambi. Oba batwale emirambo oba bagende bakole kati pain ya sickle cell ng'ekuluma bane teyinza kuwa bugumiikiriza bugenda wa RDC.
If we don't do well, we can end up killing more people who would be saved. Someone has malaria, a child is convulsing, and then say, oh no, you are the private, no. So we call upon everybody who is implementing this to apply ration, to apply logic, and to listen. I may come and I don't have a sticker, but I have someone laboring in the car.
But desperate times are now calling for desperate measures, with prevention being better than cure. Namirimu has advice for other sicklers on how to prevent attacks.
Ate obulwadde bw'esikosozi buli bwe bweraliikirira oyongera bukola ki? Buleeta kiri emirundi 3 okweziyiza omusujja malaria. Byebyo twebaka wansi w'akatimba ak'ensiri ekiddako empewo ne stress.
A balanced diet is crucial. Ruth Nankanja, the founder and executive director of the Sickle Cell Association of Uganda, left Kampala for her village in Matuga on Sunday aboard a tractor, having anticipated the lockdown.
I know here I can afford to get a jackfruit for free. I'll get some vegetables for free. I have also started planting mine, and I can get a meal for free because there's a garden. But then I'm imagining those sicklers out there who have no garden and break down probably because the nutrition is bad.
Nankanja urges government to decentralize the issuing of movement permits so that people with emergency health conditions who have access to personal cars can approach their parish chiefs for permission to go to hospital. Gillian Nantume, NTV.